how much do you think you're getting that point across to people? Because, like I said, it was so young, and I've got another son who I'm pretty sure is CMT. I've got 2 other sons as well, but I'm pretty sure he is. But every time I say to the doctor, no, he's not got high insteps yet, he's very flat-footed and tippy-toes and falls over, I think he's CMT. Oh, you don't want him diagnosed, you don't want to know that, you don't want him labelled.
So, I mean, I think it's a couple of points there. First of all, we don't know yet if early physio helps. My instinct is, why not do it? You know, why not stretch those muscles? You know, and I've certainly seen people, I've had a patient come to me fairly recently, 24, with CMT1A. His strength was 90% normal, so he was really good, but he was in a wheelchair because of foot deformity. But I'm talking about really severe and needing amputations. Now that's very rare, but that's someone who never saw any kind of therapist or doctor. So my instinct is it probably would be beneficial. I think we're all going through a little bit of change. One of the first big genes to be discovered in neurology was Huntington's disease gene, and that's a very severe neurodegenerative disease. It doesn't come on till your 30s. So there was a ruling made in the UK that nobody with an adult onset disease was allowed to have genetic testing until they were 18, able to make their own decision. And when CMT genes became known, the same ruling was advised, not made a ruling, and we were all told, do not test a child unless they have signs, because there is no effective treatment. And that's still more or less the description. The problem is that the minute, in my opinion, a parent has any concerns whatsoever, then testing should happen. Even if it's just the big toe doesn't do the right thing, or because as I said to you, in my list of diagnostic, I think parents are best. And I think that is when it's critical to get physiotherapy, even if it's just keeping an eye on things, measuring things. That would be my practice and my suggestion. Certainly the clinic in Great Ormond Street is a clinic I work very closely with, because that's the paediatric end of ours, and that's where I refer everyone. Now, at the moment, if I have an adult in my clinic, I refer the child. I'm not supposed to, it's meant to go back to the GP, but I've realised that doesn't work. So nobody stopped me, I'm sure they will. But I think if you go to a GP and you want your child seen, you insist your child is seen. You just insist your child is seen, and you can say it's best practice. So I would say best practice, if the parents wants the child seen, the child should be seen. That doesn't mean they'll have a horrible test. If someone thinks they're completely normal, they'll see them again in 6 months or a year. But I think if a parent wants a child seen, the child should be seen. And I think anyone that doesn't allow that to happen, it's just a matter of shouting louder, and there's always ways around things. There's always ways of making people do things you want, I find.